As a hospital management, I can today report without fear or favor. I can report that there's no any services that we have downgraded.
The patient had presented with difficulty in breathing. She had stridor because of the mass. It was quite big, so it was involving both lobes of the thyroid gland, and it was giving her difficulty. So in any case, we had to intervene. We had to do the surgery.
It was very unique since the case was a chronic case of more than 10 years. This case is about a refugee lady, a lady from the refugee camp, a 21-year-old lady. She was pregnant, expectant, and she had the full gestation period. And again, she also had massive multinodular goiter, that is an enlarged thyroid gland, very much massive. Our multidisciplinary team, led by Dr. Fuad Farah, and included other specialists, has also now taken this case. This case was a referral from Hagardera refugee camp, and the lady was having these two cases. A primary resource for visiting this facility, to referral to this facility, was this case of she had the pregnancy, which was termed pregnancy, and again this massive goiter, which has become multinodular because it has spread all over the neck and those face and around the mandibular areas. So, and this is a success story because owing to the chronic, this lady has been having this case for the last 10 years and above, and this lady has also been referred several times, unsuccessfully referred to Nairobi for further kind of attention and management. So it was something which is had been psychological psychotrauma even to this lady and the family. So it has been a very success story, and we having at the background right now those success stories, which we can say that our multidisciplinary specialists have done a very good work. So we are very much happy to that extent. This lady is called Bisharo Iftin, a 21-year-old with those two cases, and now that is today she's went out of the two operations. The two operations, at least at least one after another. So she has undergone the obstetric operation, cesarean section. She has been delivered a very stable child, or kind of a baby. So she, again she has underwent this long surgery. So it is, she has now successfully come out of the theater, thanks God, with all this team around, at least doing all their best.
Operated on a patient today. She's a female patient, a young lady, 21 years old. She's a referral from the refugee camp. She presented to us because of labor-related issues. She's gravid. So she had her delivery done successfully. After she delivered, the team in maternity also realized she had a very huge multinodular goiter. So they called us to review the patient. The patient was reviewed by the team of the ENT surgeons. With me here is Dr. Fuad, the ENT surgeon. Me, I'm Dr. Mohammed Noor, I'm a vascular surgeon. And Dr. Yusuf, the general surgeon, who's not here with us. So it was a huge multinodular goiter. We managed to remove it successfully, and the patient now is recovering well. It's a very technical surgery. That's the reason why we had to get 3 teams of surgeons with very experienced nurses and anesthesia team. It took time to prepare the patient for surgery. For that, you can understand that it was a very difficult and technical surgery.
Patient had presented with difficulty in breathing. She had stridor because of the mass. It was quite big, so it was involving both lobes of the thyroid gland, and it was giving her difficulty. So in any case, we had to intervene. We had to do the surgery, at least to relieve that upper airway obstruction. And I'm glad it's been successful. It was quite a vascular multinodular goiter, but we have managed also to transfuse the patient. And currently the patient is going to ICU for 24 hours observation. Yeah. I'm happy that we have been able to do the procedure. Initially, the patient was referred to Nairobi, but the fact that the patient comes from the refugee camps, there was challenge with travel, and also there was also financial constraint. Yeah, so me and my colleagues have decided to try and do the procedure, and we are glad that it's been successful.
It's a county referral hospital, or the former provincial general hospital. It's a regional hub. It's a regional healthcare hub. It's been utilized by a large scope of areas and population. The referrals we are receiving is as far as Somalia, southern Somalia. We are also receiving some referral from even part of Ethiopia. The other adjacent counties, this is the referral destination. That is from Lamu, Tana River, Isiolo, Mandera, Wajir counties. These are all counties which are referring their patient to the hospital, this facility. Therefore, it is, despite the strike of the three cadres, which has started on 3rd March, we are, as a hospital management, I can today report without fear or favor, I can report that there's no any services that we have downgraded or scaled down. So the hospital has been at least continuing and then delivering. The hospital services have been all of it to continuing and at least delivering all the service at all service points. And that's why we can say, in connection, in relation to this case, which could not have even, and many cases of maternal nature, so many cases which has been done around here, obstetric cases, those cases, including the case of Bisharo, the young refugee lady, will not have seen the light of the day if the operation of this hospital scaled down. We just say that we can vividly say that this hospital has defied all the odds from the time they started and then continue to give the services, and operation is operationalized, and all the medics in these other cadres who have been around, and we have also been supported by locums and county contract officers and also UHC staff. Those are the people who are supporting the lifeline that this hospital continues to discharge its mandates to the community. First of all, strike is within the constitution, the Kenyan constitution, for picketing, assembling, picketing, and demonstration for certain particular reasons. Within the union, kind of, what they have seen it as something that is not in line with the interest of their members, is within the constitution. But having said that, attending to emergencies and critical care is also within the inculcated in our pragmatic Kenya Constitution 2010. If you read Article 43.2, it is said that nobody should be denied emergency services, and everybody is entitled to get emergency services. That means all the health workers, wherever they are, whether they are public or private, they are expected to first of all, conduct an emergency, and then so to stabilize that patient. So when you read the Kenya Constitution, that article, together with the Health Act 2017, Chapter 7, it also talks what constitutes about emergencies. What constitutes about emergencies, it's about issue of maternity services, then renal services, theater services, ICU and HDU services, which are critical care centers. So this also have elaborated what constitutes that. And that now, in that chapter, it says that all health workers have to abide, despite any grievances they might have, they must going to at least attend to emergencies at those particular areas which has been identified by the article. Coming to, again, the Kenya Health Policy, 2014 to 2030, it also emphasizes the issue of an importance of emergency in line to the professionals, professionalism. So it is something which is very important that people should understand that.